Hey guys, this is Dr. Sandy with another exciting video for you and your family and friends. This video is dedicated to the knees, the 4 best stretches for the knees. So I'm going to walk you through that. If you're watching for the first time, my name is Dr. Sandy. I am a practicing chiropractor, been over 20 years. I've personally done over 300,000 chiropractic adjustments. Still learning, still training. I still want to get better to help our patients. Yes, I've learned a lot, but I still want to get better. And I wanted to make these videos. And if you've been watching over the past few weeks, I've been going over different areas in the body to stretch because I really believe if you stretch on a regular basis, first of all, if there is discomfort in the body, this is a good tool. And then if you are feeling good, guess what? You should still be doing these stretches because we want to be proactive. And I got to tell you, one of my favorite things with chiropractic is that it's a very proactive model. Of course, if someone's suffering, we want to help them and get them to a baseline level. But what I also love with chiropractic and what it teaches is that we should be proactive. So even if someone is feeling strong, what can we do to maintain the body, keep it healthy? We don't want to go from crisis to crisis, pain management, because the danger with that model, if you always wait till it gets really bad, it takes so much effort to bring it back. And at a certain point, if you keep waiting till it gets worse and worse and worse, there may be a time that conservative care like chiropractic stretching, it's not helping anymore. And then we need to introduce some strong medication. And then if it gets really severe, someone might need a surgery. And I just feel bad because I think in a lot of cases, if that person had maintained the body, taken care of the body, with regular chiropractic, with a good stretching program, proper nutrition, all that good stuff, a lot of that could have been avoided. So yeah, is there a time and place for a surgery or a certain medication and crisis intervention? Of course there is, but I think we have a responsibility to say, hey, I need to take care of my body. Every day we're obviously getting older. What can I do to make sure that I have an amazing quality of life, not just now, but well into the future? And I know that actually when I take care of my body, when it feels strong, I can keep it strong. But if I wait for it to fall apart, try to build it up again, that's cool. But if I don't maintain it and I go from crisis to crisis, it can lead to long-term damage, which obviously we want to avoid. So just wanted to say that. And by the way, if you've been following these videos, if I go back, I think a couple of months ago now, so I was actually experiencing some severe low back pain. I was stretching and doing that stuff, but the main thing that got me through it, I saw my chiropractor. I was going on a regular basis quite frequently. And guess what? Now I'm feeling much stronger, much better. I'm exercising. I'm feeling great. I am so grateful. And do you think I've stopped my chiropractic care? Absolutely not. I am going once a week for maintenance, talking to my doctor and saying, okay, what can I do? What areas are we working on? What can I do to get better? Because I want to be the best expression of myself. I don't want to be Dr. Sandy at 40% or 50%, as close as possible to 100%. And I hope if you're watching this video, you have a proactive attitude where you're saying, if you're listening to this with a health challenge, let's get through it. But once we get through it, let's take care of the body. Maybe you're listening to this and you're like, actually, I feel great. Great, we still got work to do. We should always be in training, always taking care of the body so you have a good life today, but also in the future. And have you asked yourself that the way I'm acting now, if I do this for the next few years, will I be happy? Or if I continue down this path, am I just breaking down? And I really hope you're choosing a path of health, happiness, taking care of the body so you can be the best version of yourself. So having said all that, to say, let's get into the stretches. So if we look over here, this is the wall, and this is the first one we're going to do is the wall stretch. So hands are anchored here. My left knee is slightly bent. Right leg is straight. The foot in the beginning, it may be hard for you to do this, but should be completely flat, looking straight ahead. And again, what is the golden rule with all our stretches? Safety first. So you want to be comfortable. They should feel relaxing. If you're doing any of the stretches and you feel uncomfortable, stop immediately. And by the way, I'm making this video to help you. If you've had knee issues for a while, if you're experiencing knee issues and it's recent, and you're concerned about it, please contact obviously a health professional. But these stretches I'm showing you, you got to be comfortable. Number one rule, if they don't feel comfortable, you stop. So you're back here again. We're doing the stretch. We're here, and again, this is very passive, not doing much, but the main intention is over here on the right leg. Again, you may do 5 or 10 seconds, foot should be flat, and you want to modify, right? So if it's hard to do 2 seconds, you stop, right? Maybe you can go up to 30. 30 to me is a good stretch. And if you're like, this is way too easy, Dr. Sandy, so guess what? We'll go up to a minute, minute and a half. So I'm going to show you these stretches, but modify. And also when it comes to the knees, there might be one side that's easy and the other side's harder, so you want to modify. And then when you find that area that's bothering you, so for example, if I do this stretch and I'm like, wow, I can literally do just a couple of seconds because I really feel it in my knee, I'm going to make a mental note. I'll do other stretches throughout the day, but that one I'm going to do throughout the day, maybe even 3 times, maybe 4 times. And I may only hold for like 1 or 2 seconds, but I know my body, if it's feeling sore in that area, it's like, okay, it needs more attention. It's giving me feedback. So I'll do my other stretches, but I'll pay extra attention on that. And again, I might only do a few seconds, but I might go high frequency, so multiple times in the day. Because the body's saying it needs help, it needs attention there. We shouldn't be listening to our bodies. So obviously I'm going to do, both sides. We'll be doing that stretch, okay? And this would be also good to do before you go for a walk. If you love to jog, if you love to run, I would highly recommend these because when we run or jog, it really takes a toll, obviously, on the knees. So we started with a wall stretch, knee flexion. So we're over here, and what I would recommend, keep the hand anchored. You're going to bring your hand over here and just bring the knee to chest as best you can, okay? Now, the other thing you can do, you can use this for support. I think that feels very safe. If you feel strong enough and you have the balance, you can just literally do this. Good balance exercise, but a good way to stretch the knee. And I do have to be careful. But yeah, you can do this. I would say this is advanced. Only do this if you feel comfortable. Again, I would prefer use the wall, but if you feel comfortable, if all this is too hard, you may actually want to lie on the ground, and maybe in the morning when you're in your bed and you're about to get out of bed, you can just do this, and that would be the easiest way and safest way to do it. So just knee to chest. Again, hold for what you can tolerate. Great exercise. So that's knee flexion. Quad stretch. Again, coming back to the wall, and I'm trying to show you stuff you can do on the wall or standing because I know a lot of you are busy. So I'm trying to show you stretches that you might be able to do at work, just anywhere, so you don't need to always go on the ground. So quad stretch, so we're holding onto the wall, gonna grab that leg, I'm holding onto my ankle, and I'm just gonna pull up. And then what I personally like to do, just gonna get comfortable here. So I'm like this, and then I love to go forward because I can really feel that stretch. I absolutely love this stretch. I love doing this. Okay, and we should obviously do the other side, grabbing that ankle and then just going forward. In the beginning, you might do this. In the beginning, I've seen some people do this. They can only kind of hold on to their pant. They might only able to do this. It's very limited, right? They can only do that. See what you feel comfortable with. You may have to build up to it, but eventually, as best you can. Obviously, if you've had a knee surgery, some of these might be very difficult. So obviously, we're only going to do what's comfortable. But if you can do this, it really helps with the knees. Now, you'll notice as we do these exercise, it's obviously bringing different muscle groups, things like your quads. That's like a quad stretch, obviously. So it really opens up that area. And then I'm going to go into another one, which is knee extension, which actually brings in the hamstrings, which are the muscle groups back here. So with this one, you're going to have your foot pointing up. I'm standing like this, and then I'm going to slowly drop back. Okay, so I'm standing, foot is going to go up, and I'm going to slowly drop back like this, and I can really feel a good pull in the hamstring. I can even feel it through my whole leg, right through here. And see, if I do this, I'll feel it to a certain degree, but if I pull this up, I'm feeling this in my calf, my hamstring, through this whole area. And you can just put your hands here, and you kind of just drop. And again, it's just really pulling in the leg. That's a beautiful stretch. I'm really enjoying that. It feels good. It's like a good sore, which is kind of what you're looking for. So you're going back and you're doing this one. And again, there's so many modifications. You may want to do hip. You may want to, again, for safety, hold on to this. You may feel like you get both hands and then you're using the knee gently for support. Just above the knee, I wouldn't push on the joint, but just on the quad. I'll just show this side as well. Foot all the way up. And then you can play with the distance, right? So maybe I can only do this in the beginning. Advanced would be having it more far out, and I'm dropping all of this. Just, oh, I'm just loving it. This is a really good stretch. So please, if you go for walks, if you jog, if you run, if you can do this before and after, it just takes a few minutes, but you'll feel so much better. And I'm catching my, this is like a workout. It really gets the body moving. So hope you enjoyed the video. As always, take care of your body. The chiropractic message is that motion is health. When you are in motion, you are better for it. Let's get that amazing quality of life that you deserve. You're amazing. God bless you. I will see you next week. Dr. Sandy signing off. Thank you.